Today we know here what is CPR, indication of CPR and procedure of CPR. If someone collapsed in front of you, what can you do? First, ensure the safety. Ensure the safety of yourself and the victim before the approaching to him. After approaching him, check the response. Shake gently the victim and ask loudly, like "Hello, are you okay?" two to three times, and call for help. Call ambulance and keep on loudspeaker. Ask to assist. Get EED if available. EED is a automated external defibrillator. That is a medical device that can be analyze the heart rhythm and if necessary deliver electric shock or defibrillation to help the heart re-establish the effective rhythm. Check for breathing. How to check the breathing? Breathing check by look the chest movement, feel and listen the noise air from nose air. Feel the listen the nose air breathing. And for pulse, check the carotid pulse. In breathing, gasping or abnormal breathing may have the victim gasping like this. And check the pulse for 10 seconds. The major pulse is checked is carotid pulse for 10 seconds. After this, three scenario are comes. Scene 1 is normal breathing victim and normal pulse felt. Monitor the patient until the ambulance is come. Scene 2 is no breathing but definitive pulse felt. So give rescue breathing, 1 breath per second, and continue checking the pulse. How give the rescue breathing? You can see in this image. Open airway by lifting the chin slightly and pinch the nose and give 2 rescue breath and watch the chest rising. Here you can see. Or if you have ambu bag, use it for rescue breathing. Scene third is no normal breathing or gasping, no normal pulse felt. It may be due to the cardiac arrest. Cardiac arrest causes ventricular fibrillation is the most common cause. Occurs due to the myocardial ischemia, myocardial infarction, ischemia or electrocution, asystole. It is due to the failure of conduction tissue and maybe electromechanical dissociation in which normal electrical activity but the cardiac output occurs in but no cardiac output. It occurs in cardiac rupture or massive pulmonary embolism. Irreversible damage can occur if the circulation is not restored in 2 or 3 minutes. Start CPR immediately. Interlock finger, hand, palm to the dorsum. Place hands on lower 1/3 of the sternum. Like in this image you can see. Place lower 1/3 of sternum and bend over the patient without bending your elbow and give compression with pressure coming from your shoulder. Pressure coming from your shoulder. Do not bend your elbow. For 1 to 12 year age group, use heel of one hand. For 0 to 1 age group, use 2 finger, typically the middle and ring finger. 30 compression and to breathe. Makes your chest recoils properly. Avoid interruption less than 10 seconds. Chest compression fraction ratio is 80%. Depth must be 2 inches or 5 centimeter. For infant 0 to 1 age, the chest depth is 1.5 inches. For 1 to 12 age, 2 inches or 1 upon third chest width. Do in a coordinated manner and perform compression at 100 to 120 per minute until the professional help arrive. Continue the CPR. If you are performing CPR on an adult or child, you should continue CPR until the trained medical professionals such as paramedical or EMTs arrive at the scene. They will take over
Resuscitation.
resuscitation efforts. And second is until return of spontaneous recirculation. Return of spontaneous recirculation. If the victim shows sign of life, such as normal breathing and a pulse, you should stop the CPR immediately. Continue to monitor the victim closely and provide any necessary first aid or assistance. You can see in this image